And I hear an echo. Okay, we are live. Okay, hello, and welcome to the Global Youth Mental Health Awareness Show, where we have open conversations with youth about mental health. I'm your host, KATINDA NDOLA, and the author of The Big Comeback, and founder of the Confidence and Self-Esteem Academy, and one of GYMHA's special board advisors. Now, today is the 10th of October, and it is a celebration of the World Mental Health Day. And before we begin our show today, I just want to congratulate 45 of the PFA students who graduated yesterday. And I believe we're going to have a video in the middle of this conversation today about some of the students. One of the students will give us a testimony of what she believes she benefited from this course. Now, in today's show, we are so blessed to be in the presence of three amazing panelists. Our first panelist is Edith Wanyonyi. Edith is a counseling psychologist, community development practitioner, GYMHA's advocacy manager and ambassador. Hello and welcome to the show, Edith.
Thank you very much, Katinda. It's always a pleasure being here. Yeah, thank
Nice to see you. And our second panelist is Dr. David David. David is the communication and information director at GYMHA. He's the founder, CEO at Nigeria Books of Record Research Center, founder, CEO of Record Breakers Books, and founder, CEO Reads Campaign Africa. Hello, welcome to the show, Dr. David.
Thank you very much, Katinda. It's wonderful to be on the show today.
Nice to see you too. And our third panelist is Brenda Nyokabi. Brenda is GYMHA's project support officer. Hello and welcome to the show, Brenda. Unmute yourself. Brenda, we can't hear you. You need to unmute yourself.
Hi everyone, how are you? I know the background is a bit shaky, but I'm up and I have unmuted. Now can you hear me?
Yes.
Hello?
Yes, we can hear you. Hello. Okay.
Hello.
So, Brenda, we can hear you. Go ahead.
Okay. Okay, thank you for having me.
Thank you for being in the show today. So, in our conversation today, our guests will give us some insights on suicide prevention. But before we dive in
Hello.
deeper into the show, I would love to know, how are we feeling today? Edith.
Oh, thank you, Katinda. Today I'm feeling great and excited. We are commemorating the World Mental Health Day, and our topic today actually aligns well with this day because there's no way we can talk about suicide and not talk about mental health. So just creating awareness is what we are to do here today, and that makes me really excited. Yeah, thank you.
Thank you. Dr. David, how are you feeling today?
Yeah, I'm feeling excited as well because we're about to talk about a subject that is what most people is going to give a lot of people hope, and is going to help a lot of people from killing themselves. So it's always wonderful to be of help to humanity. So I'm excited today to be on the show, to bring out part of the contribution to be able to create this awareness for the world.
Thank you. And Brenda, how are you feeling today? Brenda, can you hear us? Okay, so I don't know whether Brenda can hear. Brenda, you need to unmute yourself. Okay, so I don't know whether Brenda can hear us, but we'll just keep going. So today's topic is about suicide prevention. So David, Dr. David, we'll start with you. How do you define suicide? What is suicide?
Yes, the word suicide. Let's look at the literal meaning of suicide. Suicide can be defined as the intentional taking of one's own life. That is, you intentionally commit an atrocity of taking your own life. Suicide means ending your own life. That's what suicide is. And it is sometimes a way for people to escape pain. Sometimes they feel when they do that, they escape suffering. You know, when someone ends their own life, we can confidently say, okay, this person died by suicide. That is what suicide is.
Thank you. Thank you. Edith, what would you like to add on to that?
Thank you very much, Katinda. I'll just recap on what Dr. David has said. Suicide is the intention of taking one's own life. So if a person harms themselves with the intention of dying, it means that that is suicide. And people normally do this because they are unable to cope with an overwhelming situation. So they feel like there's no exit route because maybe they are going through a situation that is very overwhelming and very hard for them. And so it leads to them having the suicidal thoughts and thinking about taking their own lives. And I would say that they, as much as it's intentional, they always battle with they battle with death and life. And they do this because they're not in their right state of mind. So a person normally wants to take away their life because they are overwhelmed and they're not in their right state of mind at that time. And so there are very many causes of suicide. So like the World Health Organization, it states that about 800,000 people die by suicide every year. And you see, that's like a very large number. And it's so sad because suicide, most of the time, suicide is preventable, and it's very tragic to families. And the bereaved families, it's very tragic to them when they lose a loved one by suicide. So it's very important that we create awareness in this area. Yeah, because it's a pandemic by itself. Yeah, thank you.
Thank you. Thank you. So I see we've got Brenda back here. Please just remember to mute yourself when you're not speaking to avoid a lot of interference, because I feel like we've got some interference on the line today. So what are the signs and symptoms of suicide? Brenda, did you want to give some insight on that? Please unmute yourself.
Hi everyone, you can hear me now?
Yes.
Okay, so the signs and symptoms of suicide is when one of it I can say is when someone is talking about it. Someone will be like, oh, I wish I was dead. Oh, I wish I didn't wake up today. Oh, I'm going to do this. So that's one sign of and symptoms of suicide. The second one I can say, sometimes people tend to give out their belongings. You know, someone will come and say, oh, I've given you this because I'm not going to live anymore. So that's also a sign of someone who wants to commit suicide or ending their own lives. Also, I'll say depression, because depression, sometimes your mood can be high, sometimes your mood can be low. So that's also a sign of suicide. Another one I can say, when someone is hopeless in life, everything they see, anything they do, they just feel like, oh, this is not good for me, this is not going according to life, I want to be here, I want to be that. So hopelessness. So those are the signs I can say, signs and symptoms of suicide. Thank you,
Thank you.
Katinda.
Thank you, Brenda, for that. Dr. David, what would you like to add to that? Unmute yourself.
I just said, we see some people with this kind, most times they withdraw themselves from social contact. You see them, they want to be left alone. They don't want you to talk to them. Actually, most times you see them withdrawing themselves. And then most of people that are having some, symptoms of suicide, they always have mood swings. You know, they feel somehow today, right now, they want to do something else. You see them coming excited at the time, and sometimes they wouldn't even want to talk to you. So most of them too. Another sign is you see them, they feel trapped in what they do. There's no serious commitment into, trying to make things work for them. They just get trapped. They stop at a point. They don't feel like going forward anymore. Most of them get involved in destructive activities. See somebody who don't even know how to jump or know how to swim, telling you want to go swimming, when you don't know how to swim, because it feels if like, there's nothing to live for anymore. So they get engaged in high risky things that they've not been involved in doing, because they feel there's no hope again. Most of them too, they get involved in high use of drugs, sometimes high use of alcohol, get drunk because they want to drown on their problems. Most times you see some of them changing a routine. Someone is planning to have an event, and then at the end of the day, he's not only attending, he's not talking to people, telling people about the reason why he's not coming. He's just withdraw from that event, changing routine without informing, the people. That is one of the symptoms that we can really see. Most times, aside from these other symptoms we have mentioned and the ones that was mentioned before, you see people who are having symptoms of suicide, doing things absolutely different from others. They try to differentiate themselves, trying to take themselves off the world they are, trying to get themselves occupied with, intent of pains, sorrow. You see them, they're always bitter. You drive a car, unfortunately, maybe, I'm taking an instance from this part of the world where I'm from. A car just splash water on somebody, and the person come and they run onto the car. Person, they should check the person need help. Maybe he's having some symptom of, suicide, because it's just being bitter unnecessarily. That situation could have been something, that one can actually resolve. You see, some people, I've seen too many people having accident on the way, and then just a little car, hitting your car. Someone comes out and then start shouting. Then from there, start engaging blow. You see someone with tie engaging blow, on the public outing. That is symptom of suicide. That person is not feeling well. That person needs to be attended to. If someone should look into, that individual need help. So those are some of the symptoms that are very easy to be noted. Most of these warning signs are not always obvious, because there are some people too, they are not making it very clear. You hardly see this side. There are some people who hide their suicide intent. They hide themselves from bringing it out. So it's difficult to see. But once we see some of these known signs coming out, we need to get close to the individual. Know that this person needs help.
Thank you, David. Yes, I know some of it is very unseen. We don't see it because some people are very good at also hiding their emotions and not showing or not even asking for help. So that can be a very big problem, because sometimes you can't tell unless somebody is exhibiting certain type of signs, like you said. So Edith, what would you like to add to that? What are some signs and symptoms of suicide? What's your take on that?
Okay, thank you very much. Now, I'd say that when for one to start contemplating on suicide, it means that they are going through something. There is a cause for that. So we have like different causes that may lead someone to start contemplating suicide. And the first one is usually a mental illness, an existing mental illness, maybe depression, a substance use disorder, or bipolar, or any other mental illness could lead someone to start contemplating suicide. And then we have substance use. I've said that, alcohol and drugs, life experiences like loss and grief. You could lose a loved one, you could lose a job, postpartum depression, and many other causes, even physical illness, chronic pain. So someone may feel like they're not getting better anymore, and the thoughts of suicide could start cropping in. So like the first sign for the first sign of suicide is withdrawal and isolation. You realize that someone who used to be an extrovert and is with people all the time is likely to withdraw and isolate themselves and not want to talk to people. And then being in possession of lethal means, such like a knife, a gun, a rope. These are means of suicide that people, when you notice that someone is possessing such things, it could be an alert that this person is contemplating suicide. Then we have signs of depression. I could say that suicide and depression co-occur. So there's no way we are talking about suicide and leave depression out. So a person could start having sleep problems and appetite problems. They are not able to eat or to sleep well. They are not able to think clearly. They want to be by themselves all the time. And just talking about suicide, when you realize that someone, their sentiments, like I want to die, I wish I was not here, or they are blaming themselves, they feel like a burden to other people, that is a sign that they may be contemplating suicide. And also just feeling very overwhelmed, feeling hopeless and helpless and meaningless in life. Yeah, those are the signs of suicide.
Thank you. Thank you. I see here we've got a comment from Katerina Pearls. She says also depression and heartbreak. Yes, that can also be a symptom, or maybe actually people who are prone to suicide because of heartbreak or depression as well. So moving forward, who is more prone to suicide? Dr. David.
There are so many people that we can mention here, but I want to talk about men at first. Men are more prone to suicide. You know why? Because most times men don't talk. If you are contemplating suicide, and then one of the cure of this is when someone is contemplating suicide and is able to talk to someone, or someone is in a position of chatting with others. There's a way you can talk, and then people get to know about your problem, and then solution would come, and somebody would even know, okay, this person is contemplating this, and then help would come. But in the nature of man, man would not want to talk, would not want to engage in discussions, especially let me say people, so that people will say is part of masculinity. They will say, okay, you want to be a man. So because of that, these men always have this in their thoughts. They won't want to talk about it, so they keep it within them. And because of that, they are prone to suicide than women who always engage in having to talk about what they are feeling, what they are passing through, relating with others. And these sometimes get solution. And that's why I would say that most times men are more prone to suicide. And also, generally speaking, we can say people who are having mental health issues, generally now, between men and women, generally, people who are having mental health issues, who are, passing through depression, who are having different mental health issues. These are people who are also very prone to suicide. And let's say people who are having also issues, maybe issues in their marriage. So we can mention people like, let's say, someone who is divorced, someone who is having relationship issues is more prone to suicide. And again, also people who live in more deprived areas, where there is less access to things like normal service, like work, education. People are living in such areas, they are always prone to suicide. And people among more deprived people that are more deprived of necessity of life, these people too are also prone to suicide. And also different professions. There are some specific professions that people get into their career and then they are prone to suicide. For instance, let's take an instance like writers, people who write, actors, painters who are involved in creative works. Sometimes you get involved in that. Sometimes I've come across several writers who said, okay, because my work is not selling or people are not, looking at what I do, they feel, oh, how I wish I was not even born. How I wish I wasn't even, doing this. Due to that job, you're bringing in high mental concentration into your job, and you see that probably your work is not accepted in the society. People are not looking at it as something very important. People like these, people in this kind of profession that has to do with high mental thinking, creativity, they feel that people are not appreciating what they do. These people too are more likely to think of or contemplate suicide.
Thank you, Dr. David. Brenda, what is your take on who is more prone to suicide?
Okay, I'll say people who are prone to suicide. I'll say a different points. I'll say people, one, I'll put them in mental disorders, people who have mental health issues, people who have depression, people who have bipolar, people who have PTSD, trauma, child abuse. Those are people also who are prone to abuse. To suicide. Also, I'll say people who are. I can say also people who are lesbian, gay, transgender, because they don't have a supportive community, so they tend to kill themselves. Also, I'll say people who are in prison, because someone can go to prison and think, oh my God, this is the end of my life. So someone tends to kill themselves. Also, I'll say people who have chronic pain, like people who are in hospital, they'll be like, I've given up my life. I don't want to feel any more pain. They'll be like, let me take medicine and just end life. Also, I'll say people who are the vulnerable groups, people who are in financial debt, people who don't want to pay debt, they'll be like, oh, I can't do this, so they kill themselves. That's what I can say, people who are prone to suicide. Thank you,
Yeah, that's a
Katinda.
lot. That's a lot of people, actually, when you think about it. That's a
Yes,
lot of
yeah.
people. Yeah, I didn't actually consider, I just didn't think about the prison, which is quite critical because they're isolated as well. And it could be a scenario where you think your life is hopeless completely. And that's why people think of these ways of ending their life. Now, Edith, what else could you add to that? Who is more prone to suicide? I know Brenda has probably said most of them, and David too. So what are your thoughts?
Uh, thank you very much. You've talked about prison, and I've just remembered that most of the time we stigmatize suicide. And just the fact that we say committed suicide, the statement itself is laden with blame and stigma. And so convicting people who attempted suicide is wrong, and it's very sad. And so even the World Health Organization actually discourages using of that term, committing suicide. And so we should be very careful when we are addressing matters of mental health and suicide. Our language really matters. Yeah, so I would urge all of us to actually check on that. And also, we are talking about people who are prone to suicide. Actually, everyone is at risk, but there are those people who are more at risk of taking their own lives. And so we have like people with an existing mental illness. We've talked about depression. We've talked about substance use disorders. You realize that they are driven by an impulsive thought. So people who are abusing alcohol or drugs or with an existing mental illness could take away their lives because of impulsivity. And so we have even groups that are discriminated. Like Brenda had said, we have the LGBTI group, we have the refugees, and people who are just facing discrimination in society. We have children who've been defiled, sexual abuse. We have people who are prone to war countries, and people who have been isolated and separated from their families. Uh, we have so many people. And a few years ago, when I was working with the refugees, it's when it opened my eyes, because there a few groups of people that I worked with. I worked with young girls who had been raped, and they got children as a result of sexual abuse. And then we had men who had been sodomized, and so they have lost their identity. And it was really tough, because it's really tough to get someone out of a dark mental state. And so we should be really careful even when we are addressing suicide. And it really breaks my heart every time I see someone make fun of suicide or just brush it off, because I know the depth and the magnitude of pain and just losing your identity and losing yourself, and being so overwhelmed with thoughts and just feeling like you're hopeless and helpless and like life has lost meaning. So we really need to be careful, and we really need to support people who have gone through, who are contemplating suicide or have attempted suicide, because also those people who have attempted suicide are at a risk of attempting another suicide another time. So when we find out that someone attempted suicide, instead of convicting them and blaming them and stigmatizing them, we need to find a way in which we can speak to them and help them get out of that situation. Yeah, thank you.
Yeah, that is actually key to having that conversation and supporting them. Because I know, like you said, Edith, there's a lot of stigma around mental health in general. So imagine when it's suicide and people know that, they still stigmatize that, and it doesn't help the person who either tried it before, who's thinking about it, because they think, oh, nobody really cares. That's why it makes it easier for them, as opposed to being empathetic and trying to find out how can you be of help, or how can you support them to actually heal from their mental illness, because that's what it's all about. Now, if you've just joined us, we're talking about the suicide prevention. And today is the World Mental Health Day, which is what we're celebrating today, the 10th of October. And in today's topic, we're talking about suicide prevention. So please click, share, comment, and invite your friends to watch and ask questions, because we've got the experts here today who can actually give you some information, inspire you, motivate you to seek help. Because the whole idea of this show, Global Youth Mental Health Awareness, is to create awareness for everyone who's watching this, but also to give you the tools to also go out there and ask for help. And also educate the people around you. So if you happen to be the one with a mental illness or going through something, find somebody you can talk to. Don't think you're alone, because you're not alone. There's a lot of resources in the world, depending what part of the world you're in, where you can actually seek help, and people should be able to help you. Now, moving forward, what is suicide prevention? Brenda, unmute yourself.
Yeah. Suicide prevention, preventability is where we put up, I wouldn't say laws, but we'll put policies on people on how to prevent people from suicide. One of the instances I can give is maybe like right now, like what Edith said, we can break the stigma and increase awareness on mental health, mental disorders, how people can live with the depression, how to treat depression, how to treat bipolar, therapy, such things. Those are what I can say suicide preventability is.
Thank you. Dr. David, what would you like to add to that? Unmute yourself, please.
All right. Can you hear me?
Yes, we can.
Good. Suicide prevention is a means of preventing people from committing suicide. It starts with recognizing the warning signs and taking them seriously. On this show, we have discussed about the warning signs, the signs of suicide. So when we see people exhibiting these signs, preventing it, we have to start taking those warning signs seriously. If you see somebody, a friend, or it could be someone, your working colleague at work, maybe a family member that is suicidal by exhibiting some of those signs, there are a lot of things we can do to prevent that victim from committing suicide. We can reach out and talk to them. We can as well encourage them and advise them, like we always do in GYMHA, advise them to seek counseling, That is very important. And also, it is all is even no news for us to know that when people feel that they don't love them, they want to think of committing suicide. So you have to show love people. Sometimes when we greet people, when you greet someone, try to listen to the tone of that greeting. Is the person responding well? It depends on how the person is responding. From there, you can get to know that this person is not actually feeling well. Show love, extend love, and then it will help to get that person back in track. And you have to get people like this, get them involved in positive social activities. It helps them to be in a place where people are. When they feel useful to themselves, then there will be no reason why they will contemplate suicide. Always feed them with good stories. Make them feel they are important. These are suicide prevention strategies that we can, apply once we feel someone is thinking of committing suicide.
Now, Dr. David, you mentioned about showing them love. How do we do that? Is it maybe by hugging them? What can we do? Can you give us some actual steps of how we can show them love?
All right. Now, let's take, for instance, there are some, especially in these post-COVID area time, a lot of people are suffering from financial help. And looking at your position as well, going out of your way to assist people financially is a way to make them know their value. And also, there are some other people too, street children, who always feel that people don't love them. See them, they call them destitute. They are being, abandoned on the street. The last time you go out to give them food, share food to them, bring them out, try to advise them, try to give them advice that can assist them, try to get them out of the slum. That last time, that is when you were showing love with them. So engaging in such activities is showing people love. There are so many people in different facets of life that need us to show them love. You cannot just do this by saying it. You have to demonstrate it. You get close to the people at the grassroots. Get involved. Forget about your social status. Forget about your position in the society. Go to the slum. There are people who are there feeling abandoned, feeling rejected. These are the people. You get close to them. Try to get them to know they are important. If you can give them scholarship. You take them out of that position and give them, education. When you do that, that is specifically showing love to some of these people. So showing love is very important to preventing people from committing suicide.
What about in the family setup? How do we show love to each other in the family setup? Because we know charity begins at home. So we could have people in the family who've got mental health. So let's talk about that too.
Now, in the family, especially for parents who are having, career job, you can see some parents, they wake up very early in the morning, they go to work, and they come back late in the night when the child has gone to bed. Now, they wake up in the morning, the child did not even see them to say good morning, and they've gone to work. They come back late in the night when the child has gone to sleep. They may not even know, what happened to the child in school. Now, you have to, as a family person, you have to be very concerned about the welfare of your children. You have to find out where they are. You have to see how they're doing, how was school. You call them closer. You have to spare out time. It depends on you when you're coming back. Even when you're coming back, you can come and watch television with them. Try to get them involved. Okay, this is the time I can donate my. You make sure before you go out, at least you have a breakfast with your family. Have that time, even if it is just 10 minutes. Use that time. You can reschedule your family schedule so that it will meet in the time which you can come out. Maybe you have breakfast with them and they get to know that you have them in your mind. They will know, okay, this is just work. It's because of work. And then apart from that, you have to create some time for you to go for recreation. You go out with them, take them out on social days. It's not every day that you go to work. What about Saturdays? You don't go to work on Saturdays, and after church on Sunday. What do you work on Sunday as well? So if you are that busy, what about those days which you are not working? then take that time out, take these people out, get your family, your wife, your children, let them feel you, let them get to know that you love them. Show love. It's not all about providing food, all about providing education, providing shelter. No, you have to make yourself available for your family, for people to know that you're caring. Now, aside from your immediate family, your extended family, like your mom, your parents, they are not living with you again. Now, when last did you put a call across to your mom? Mom, I just want to find out how you're feeling. I just want to know if you're doing well. It's not about sending money. It's not about the things we feel are more important. What about those things that people think are less important? That call, when you put that call across to your mom, your dad, maybe your sister who is not living with you, your relatives far away. Once in a while you do that, you see these people will know, wow, you're showing love to them. That's a means of showing love. That's a means of sharing love. And I feel it's very, very important because you never can tell who is contemplating suicide. Like Edith has said in this show, Edith made us to understand that suicide, a lot of people, not everybody is prone to this. Everybody is at risk of suicide. It's not some specific people alone. While some people are more prone to suicide, there are some, every one of us are prone to suicide. A lot of us, you may not know what someone is passing through, but by reaching out, you'll will be surprised. Okay, this person that you are seeing every day is dressing fine, doing very well. Why is this person contemplating suicide? That is what is happening in the world, and we have to take that part very seriously.
Yes, I know it's a sad part about also being very busy. We are busy being busy, and sometimes we're busy not being productive. So, yes, I think we need to be aware, be intentional with what we do, and show love. Show love. Yes, love is everything, I believe. So, Edith, what's your take? What is suicide prevention?
Okay, you people, you are talking about showing love, and I'm just thinking, even just listening to people, sometimes we just talk too much, but when we listen, because if someone is contemplating suicide, they need to be heard. They need someone they can talk to. So we need to be there for people, listen to them. What are they saying and what is not also being said? And then from there, we can know the direction that we can help them. And also just reaching out, like Dr. David has said, you can't just sit and you've noticed that someone is withdrawing, is isolating themselves, and don't make an effort of reaching out and asking them that you've noticed a change in their lives. So it's very important to show concern to people. And the moment you show concern, even someone who was contemplating suicide will feel that there's someone who cares about them, and they'll be able to open up. Yeah, so suicide prevention is a collection of efforts with the aim of reducing the risk of suicide. So these efforts could be from the individual level, community level, and even the society level at large. So it's like strategies and efforts between people and communities just to reduce the risk of suicide. Yeah, thank you.
Thank you. Thank you. Now, we've got a final question here. So, suicide prevention strategies, what are they? Dr. David, I see we've lost Brenda. So, what would you like to tell us about suicide prevention strategies? Unmute yourself. Thank you.
Can you hear me?
Yes, we can now.
Okay. Very well. Now, suicides are preventable. We must know that very well. So when we know that suicide itself is not the end of the world, it's something that is preventable. We know that there are strategies that we can take to, prevent suicide. Now, I think we should reduce access to the means of suicide. Things like pesticide, certain medications that are very harmful. We have to reduce the production of such items in the society. Now, our media have to engage a very responsible way of reporting suicide. Now, I come across reporting suicide. I read about an article in which a media house was reporting suicide and was mentioning the means in which this suicide was committed. And I think you are giving ideas to other people who may have who are contemplating suicide. You are giving them an easy way. So our media always give away. We have to develop our strategies of reporting in the media, making people know that suicide is wrong. It's not something that's worth engaging in doing. And also, in some countries, we have to introduce alcoholic policy. Like in my country, they tell you that if you are not up to 18 years, you should not drink alcohol. There are some places which people in all ages drink alcohol, which is very wrong. I think when you are up to 18 and above, then you'll be in some control of your senses. You'll be able to know what you're doing, so you won't be able to abuse alcohol. So I feel this is another very important strategy. We have to identify suicide early. Early identification is very important, and then recommending these people for treatment early. This is another strategy that will work. It's very, very important, and we have to train both specialists and non-specialists to be involved in health, in looking at mental health issues. It's not everybody that would be directly health workers, but you can also advocate. So we have to train people who can also specialize in healthcare advocacy, who can always talk, what we call preventive healthcare, before it happens. All right, the people who talk about this. So we have to train a lot of people and get them involved into spreading the awareness of mental health. That's why in GYMHA we say everybody can join GYMHA, because from all walks of life, everybody should be involved in advocacy. Once we bring out strategies like this, it's going to help to control and also prevent suicide.
Thank you. What about Brenda? What would you tell us? What are some strategies for preventing suicide?
Okay, one of them I can say is hotlines. Hotlines for suicide should be put in place. Someone you can talk to, someone who can be able to call and say, oh, I'm suicidal, and you can also be able to connect them with a hospital, with a doctor, with a counselor, with a psychiatrist. So that's one point. Another point I can say is we should also coordinate with other society organization, maybe like health. We coordinate with justice. We coordinate with education. When you connect all of them together, we can also prevent suicide. Yes, and also as a person also, you can also advocate for suicide, or you will be like, what, people, I'm advocating for suicide. It will happen to anyone or anyone. So yes, thank you.
Thank you, Edith. What would you like to suggest?
Okay, thank you, Katinda. Now, we are talking about suicide, and also, like we said earlier, today is the World Mental Health Awareness Day. And so our theme for this year is actually mental health in an unequal world. So what this means is that when we are talking about mental health, we have so many inequalities going on. So we have like inequalities in discrimination, gender, even in resources. So one way in which we can prevent suicide, and a strategy, is ensuring that we have a universal health coverage, even in mental health, such that mental health services are accessible. So we can say that we can have a policy on mental health, and just equal strategies, housing, reduce poverty, and alleviate those people who are in poverty stricken areas, so and make living affordable for people, so that we can reduce the thoughts of suicide, and also just including suicide in we can include suicide in what do we call it, the insurance policies, the health insurance policies. We can include mental health there, so that it's very accessible for people, because we realize that in this time and age, mental health is very necessary, but unfortunately it's very expensive for some people. They cannot be able to access it. So just ensuring that everyone is in a position that they can be able to access mental health, and also creating awareness around mental health. Like we said before, this is what we do in GYMHA. So letting people know that mental health challenges exist, that they are not alone, and they can reach out to someone and seek help, and there is no shame in seeking help. Also, providing connectedness and helping people connect at the community level, at the family level, connect with people, just know what people are going through. Yeah, take it as a responsibility to connect with people in the community and in the family level, and also let us educate people on life skills. How can they become resilient when they are faced with challenges in life, emotional intelligence, and how they can just respond to challenges, and also teach them coping skills and problem solving skills, so that if people are faced, and especially teenagers and young people, because they're the ones who find themselves really overwhelmed and they don't want to talk about it because they are afraid of stigma. So we can teach them coping skills and problem solving skills. Statistics show that from 15 years to 29 years, these people are highly prone to a mental illness, and they are highly prone to contemplating suicide. So it's very important that we create materials that can help these young ones know how can we deal with suicide, in case you're feeling overwhelmed, in case you're feeling like you're just hopeless and helpless in life. How can they deal with that? And also creating protective environments. We need to have policies around alcohol, around being in possession of some means like guns. So we need to have policies in the community and that will protect people, because when we do not have policies, this is what gives people a leeway to do what they want to do. Yeah, and so we can also strengthen economic supports, like I said, strengthen financial security, strengthen household policies, and make the living affordable for people. Also, identify and support people at risk. So when we can be able to know, like we've said, we've already known the causes of suicide, we've already known the signs. And so when we know these, we are able to support those people who are at risk. And when you notice that someone is contemplating suicide, it's not a second, you should not like give it a second thought. You should report immediately. And also just show concern and talk to them. Reach out to a number. What do we call it? A number that you can reach out, so that people can get help. Also, you can advise these people to seek help from a mental health practitioner, accompany them there. And also we should also do follow-ups. You know, if someone attempted suicide before and they have already gone through counseling, make it a point to follow up on this person and just know how they are doing. Also, we can lessen harms and prevent future risks. So, like Dr. David said, we should be very, very careful. The journalists and anyone who is reporting suicide, we should be very careful on how we are reporting suicides. You know, and especially in Kenya, that is a great problem that I noticed. In the news, you'd find that suicide is being reported very, very badly, and it can affect other people. Even just considering that the bereaved families are going through a hard time, so you don't want to add insult into injury. So being very, very compassionate to these people and understanding that it's a loss to them, and so it's traumatic also to them. So being very considerate on how we are reporting suicides. And apart from being considerate, we can also educate people. When you are reporting a suicide, make it a point of educating people on what suicide is. And when we educate people on what suicide is, also make sure that you inform them where they can seek help. Yeah, so that people know where they can turn to. And also we need to know that suicide is an aftermath of a mental health illness, and we should just not overlook that. Yeah, thank you.
Thank you. Thank you. I see here we've got a comment by Femi. Yes, thank God for GYMHA working with others. Surely will curtail the prevalence of violence in our societies. Thank you, Femi Afolabi. Now, before we conclude, yes, there's another comment. Fulfill, repent. Yes, working hand in hand with other bodies will goes a long way. Thank God for GYMHA. Thank you too for your comment. Now, before we conclude, I know there's so many ways to protect and manage your mental health and well-being. So today I'll change this topic. Usually I ask what's one thing you do on a daily basis, but today I just want you to tell me what's one word that comes to mind when it comes to your protecting your mental health and well-being. Dr. David. Unmute yourself, please.
I'm good, right?
We can hear you. Yes.
Okay, good. So, yes, we must have that watchword in our mind that no matter what we are passing through, there is nothing on earth that is worth committing suicide. No matter the pains, no matter the sorrow, no matter whatever it is, there is nothing on earth that is worth committing suicide. We should have that at the back of our mind, that whatever come will go, whatever situation, there will always be a way out. And don't forget, you have to welcome problems. Problems are not, an end to the means. Problems are stimulants to success. So when they come, you do not feel that's the end of the world. No, it's not worth it. There's nothing that is worth contemplating suicide. So with that positive mind, with that positive thinking in us, we'll see that there's no reason for committing suicide. So that's one watchword I will always keep in mind. I also encourage all my followers, all my friends and families and colleagues to always know, yes, life is good. Life is worth living.
Thank you. Brenda, what's one word you can leave us with today? Brenda, can you hear us? Okay, Edith, I think I'm not sure about Brenda, what's happening
Yes,
there?
now I can hear you. Can you repeat your question?
Yes, so before we conclude, I know there's so many ways to protect and manage your mental health and well-being, but what is one word you can leave with the viewers today? What is something you think they should start doing? You've muted yourself again. Okay, in the interest of time, I don't know what's happening with Brenda there. Edith, what would you like to say?
Okay, this is what I'll say, and this is what I tell myself every time, that I've been through difficult situations in life, and sometimes I felt overwhelmed. And so every time I find myself at a fix or at a very difficult situation, I always remind myself that I went through that, and so this too shall come to pass. So it's just a matter of time, and nothing is permanent in life. So I think that's what we need to remind ourselves like that. We've been through situations in life. I believe no one has had a smooth life or all their lives. So if you went through a challenge before and you came out of it, it's very likely that you'll also come out of what you're going through right now. So just hang in there and do what you have to do to check on your mental health. If it is talking to people, connecting with people, eating healthy, just taking care of your mental health, physical exercise, anything you have to do to take care of your mental health, please just do that. And always know that you are not alone. Yeah, there are people who are there for you. You may not know, but you have family, you have friends, and people who really care about you. So this world needs you. There's a purpose why you are brought in this world, and what you may be going through is just part of your purpose in this world. So don't give up. Hang in there, and things will get better with time. Yeah, thank you.
Thank you. Brenda, if you can hear me, what is the one word you want to leave with the viewers today? Brenda, I'm not sure, you're frozen. I'm not sure if you can see or hear. Now, before we conclude, I just want to see if we might have that video that Jude was going to play. You see.
According to the PFA information I got and according to all the knowledge I got from the PFA course, it was really impactful. As a nursing student, I think it will be of great help as I'm interacting with my patients. I have few months to finish my course. And I think this will be of great importance when I'm interacting with patients to ensure, as one of the speakers talked about holistic care, we in nursing, we holistically care for our patients, mentally, physically, socially. You just don't look at the physical well-being, but you go on to look at their emotional well-being so that they heal well. So the PFA course has impacted me with all the knowledge of caring for my patients emotionally, as I'll be able to interact with them. So I'm also a peer educator at Mbara University, Must Peer Project. I love counseling and I love passing on knowledge. I normally use my social media platforms to pass on the knowledge I get from different courses. So I use my Twitter as well to share some important information from the PFA course of giving psychological first aid. I was able to interact with many people following me on my social media platform, sharing with them the information on how they can give psychological first aid, and most of them have given me feedback that the information was really impactful. So here in Uganda, the young people use social media a lot, and most of information on social media, we use it for fun, which in turn can give depression to the young people, because people, they normally talk of their feelings, they talk about things which they are not sure how best they can hurt others. So I dedicated my social media to teaching people on whatever knowledge I get. I share it on my social media platform. Thank you so much for.
Thank you, Jude, for that sharing, for that testimony from Nabida Shamim. And once again, congratulations to the 45 psychological first aid PFA students who just graduated yesterday. That is an amazing journey. And at least we know that we have more people advocating for mental health. Now, you can actually find Global Youth Mental Health Awareness by visiting our website, www.globalyouthmentalhealthawareness.org, or you can email jude@gymha.org. Now, that's all for today. Thank you, Edith. Thank you, Dr. David. Thank you, Brenda, for sharing your insights on suicide prevention. I want to thank you, viewers, for being a fabulous audience and for watching the Global Youth Mental Health Awareness Show. As we celebrate the World Mental Health Day, remember, you are not alone. And until next time, may you all experience the frequencies of love and light. Stay blessed and stay safe. Bye for now.